Welcome to the deep dive. Today, we're going to be looking at the heart, the most vital organ, how doctors check it out, all those tests and procedures from like simple stuff to the more complex interventions. We're going to see how they figure out like what's going on and how they help treat, heart conditions. You'd be surprised at like how much they can figure out about the heart without even like opening up the chest.
It's really remarkable, the advancements. We can gather so much information like non-invasively now, like with
Oh, really?
echocardiography.
Echocardiography, that's the one with like the sound waves, right? Like they use it for pregnant women a lot, right? How does that work for the heart, though?
Well, it's the same principle as sonar. So
Yeah.
it sends out these high-frequency sound waves,
Yeah.
and then they kind of analyze the echoes,
Hmm.
like as they bounce back. And we can get these images, really detailed images of the heart, like what it looks like and how it's working.
Yeah.
It's like a window right into a beating heart. You can see the chambers and the valves and the blood flow in real time.
Wow, that's amazing. It's like a live video feed of your heart in action. So, like, why is that information so important? Like, what can you actually learn from those images?
Oh, so much. We can see a whole range of conditions. Like you can see if the heart muscle is weak or if it's thickened, if the valves are leaking or if they're narrowed, any abnormalities in the heart chambers or how the blood's flowing through.
So you can see the structure, but like, can it tell you how well the heart's actually pumping?
Absolutely. We call it the ejection fraction. It tells us like what percentage of blood is pumped out of the left ventricle every time it beats. And if it's low, that could be a sign of heart failure,
Mhm.
which means the heart's not pumping enough blood for the body.
Wow, that's incredible. I mean, sound waves, and you get all that information. So, are there different types of echocardiography? I mean,
Yeah, there are. The most common is transthoracic echocardiography. We call it TTE. It's where we put the transducer on the chest wall. It's super quick, painless, and gives us a good overview. But sometimes we need to see things a little more clearly, especially if we're looking at structures that are harder to see with the standard echo. And that's where we use transesophageal echocardiography, or T.
T. That sounds a little more involved.
It is a bit more specialized. We take a small transducer, put it on a thin, flexible tube, and guide it down the esophagus, which, sits right behind the heart. And that gives us like a much clearer view, especially the heart valves, the back of the heart,
Hmm.
and any potential blood clots that might be there.
Oh, wow. Yeah, that makes sense. For things like blood clots, especially, that could be really dangerous. Now, you mentioned manipulating the transducer during an echo. What's that all about? Is it like adjusting the camera to get the perfect shot?
It's a good way to think about it. By tilting and rotating the transducer, we can get different views of the heart. We can see specific structures more clearly. So we can like zoom in on the valves to check for leaks or narrowing, examine the walls of the heart, see if they're thickened or thin, and even assess the blood flow through the chambers.
So it's like a remote control for your heart. You can like zoom in and explore different areas. So what are some of the other tricks up your sleeve? I've heard about this thing called Doppler echocardiography. What's that?
Ah, Doppler echo. That utilizes the Doppler effect. You know how the sound of a siren changes as it comes towards you and then moves away? Well, we're looking at the changes in sound frequency, but the sound's reflected by the red blood cells moving through the heart and vessels.
So it's like using the Doppler effect to track blood flow in the heart, I mean. So how is that helpful? Like what can you learn from that?
Oh, it's super helpful for assessing the speed and direction of blood flow. Like if we see turbulent flow around a heart valve, that could indicate a problem with the valve, like stenosis, which means it's narrowed, or regurgitation, where the valve's leaking. It's super important for diagnosing and managing those types of valve problems.
Wow, that makes sense. So you can like pinpoint problem areas just by looking at the flow like in real time. That must be really helpful.
It is, and to make it even easier to interpret, we use color flow imaging. Think of it like a traffic map for your blood. The machine assigns colors to different velocities and directions. So red is usually blood flowing towards the transducer, blue away from it, and green often means turbulent flow.
Oh, that's cool. So it's like a color-coded system that highlights potential traffic jams in the heart. Now, I'm curious about this thing called contrast echocardiography. What's that about? Is it like adding filters to an Instagram photo?
Not quite. So we inject a special solution into the bloodstream, and that creates these tiny bubbles,
Mm.
and they show up on the ultrasound. We use them as tracers, so we can see exactly how blood flows through the heart chambers and detect any abnormal connections or shunts between them.
Shunts, what are those?
So shunts are like abnormal openings or passages that let blood flow between chambers that are normally separated, like, a hole in the wall between the two upper chambers. That's called an atrial septal defect, and that's a type of shunt. These shunts mess up the normal flow of blood and might need to be treated.
So it's like using these bubbles to map out the heart's plumbing. And then you can like see any leaks or detours. That's pretty ingenious. What other innovative uses are there for echocardiography?
No, there's stress echocardiography. It's a way to evaluate how the heart responds to, like, exertion. We basically put the heart through a workout, see how it performs under pressure.
A workout for the heart. Do they like make the patient do jumping jacks while they're hooked up to the echo machine?
No, not quite like that. The patient either exercises, like on a treadmill or a stationary bike, or we can give them medication that has the same effect as exercise. Then we compare echo images taken while they're resting and while they're under stress, and we can see if there are any changes in the heart wall's motion or in its pumping ability,
Why is it so important to see how the heart responds to stress?
because it can reveal problems that you might not see at rest. Like, say, a coronary artery is partially blocked. It might not cause any symptoms when the person is relaxed. But when the heart has to work harder during exercise, that blockage can, like, restrict blood flow to the heart muscle itself. And that can cause chest pain and other symptoms. So stress echo can help us detect that. We call it myocardial ischemia. It's often a sign of coronary artery disease.
So it's like a stress test for the heart to find potential blockages or weak spots that you might not see otherwise. Now, echo is non-invasive, but what about when you need to actually get a closer look? What other tools are there for that?
Well, that's where cardiac catheterization comes in. It's minimally invasive. We insert a catheter, which is a thin, flexible tube, into a blood vessel, usually in the groin or the arm, and we guide it up to the heart.
So it's like a tiny explorer on a mission to the heart. What can this explorer actually do once it gets there?
It's both diagnostic and therapeutic, actually. So on the diagnostic side, we can measure the pressure in the heart chambers, look at the blood flow through the valves,
Mm.
and even get X-ray images of the coronary arteries to look for blockages.
And on the therapeutic side,
We can actually do things like angioplasty to open blocked arteries, valve repairs or replacements, and even take biopsies to look at the tissue.
wow, that's really impressive. So it's a really versatile tool. It can like get information, A&D, treat the heart. So I'm assuming there are different types of catheters depending on what you're doing.
Oh, absolutely. There are different ones for different purposes. Some are made for measuring pressures or getting images, while others are specifically for angioplasty or stenting.
Now, I've heard of this thing called the Judkins technique. Is that related to cardiac catheterization?
Yeah, it is. It's a common way to get access to the coronary arteries during a cath. We basically guide the catheter through the femoral artery in the groin. We use X-ray guidance so we can see where we're going and make sure it gets to the right spot.
Okay, so it's a specific way to like navigate the catheter to the heart to blood vessels. Sounds like precision is really key there.
Absolutely. Cath requires a high level of skill and experience. Now, switching gears a bit, let's talk about a procedure that uses electricity to treat heart rhythm problems. It's called cardioversion.
Cardioversion, isn't that where they use those paddles to like shock the heart back into rhythm? It always looks so dramatic in movies.
It can seem that way, but it's a very controlled and safe procedure. We deliver a synchronized electric shock to the heart to get it back to a normal rhythm from a rapid or irregular heartbeat.
Synchronized. Why is that so important?
We have to synchronize the shock with the heart's own electrical activity. That way we don't deliver it during a vulnerable period, in the cardiac cycle, because that could actually trigger a more dangerous rhythm. It's all about timing and precision.
So it's not just a random jolt of electricity, it's carefully timed to reset the heart safely. What kind of conditions can you treat with cardioversion?
We often use it to treat atrial fibrillation. That's a common heart rhythm disorder where the upper chambers of the heart, they kind of quiver instead of beating effectively. That irregular rhythm can increase the risk of blood clots and stroke. So getting them back to a normal rhythm with cardioversion can be really beneficial.
That makes sense. Now, earlier we talked about transesophageal echo, or TE, as a way to get clearer images of the heart. Can you remind us, why is that sometimes necessary?
Sure. So with T, we insert a probe with an ultrasound transducer into the esophagus. Remember, the esophagus is right behind the heart.
Yeah.
And that gives us these really detailed images, especially the valves, the back of the heart, and areas where blood clots might form.
So it's like getting a backstage pass to the heart. You can see all the stuff that might be hidden with a standard echo.
It's a great way to put it. TE is super helpful for finding blood clots,
Mm.
especially in people with atrial fibrillation. You can also diagnose things like endocarditis, which is inflammation of the heart lining, and all sorts of valve diseases.
It sounds like T is essential for finding those hidden problems that might otherwise go unnoticed. Now let's talk about another imaging technique, radionuclide studies. Those sound kind of futuristic. What are they all about?
Yeah, so radionuclide studies are also called blood pool imaging. We use a tiny amount of a radioactive chemical, it's called a radionuclide, to image the heart. We inject it into the bloodstream, and it emits gamma radiation. And that's detected by a special camera, which creates images.
Wait, radioactive material, is that safe?
Oh, yeah, it's a tiny amount, and it's considered safe. The benefits we get from the information far outweigh any risk.
Okay, that makes sense.
Yeah.
So how do these radioactive chemicals help you see the heart?
So this chemical is designed to be taken up by certain cells in the heart. As it moves through the blood, it emits these gamma rays, and we can detect them with a special camera. We can create images that show how well the heart is pumping, whether there are any areas with reduced blood flow, and if the heart chambers are working properly.
So it's like giving the heart a little glow up so you can see how it's working. What kind of information can you get from these radionuclide studies?
Oh, tons of valuable insights. We can assess the size of the chambers, evaluate how well the muscle is contracting, detect damage after a heart attack, and even pinpoint areas with reduced blood flow, from blocked arteries.
It sounds like a comprehensive assessment tool. Now, I remember you mentioning something about tiny computers living inside someone's chest. What was that all about?
Ah, yes. You're talking about pacemakers and implantable cardioverter defibrillators. We call them ICDs. They're implanted under the skin, usually near the collarbone, and they connect to the heart with wires called leads.
So they're like mini medical marvels. They keep the heart's rhythm in check. What do they actually do?
So pacemakers are mainly used for slow heartbeats. We call that bradycardia. They send out tiny electrical impulses to the heart muscle, and that helps it beat at a normal rate. Now, ICDs, those are designed to treat life-threatening arrhythmias, like ventricular fibrillation, which is a really chaotic rhythm, and it can cause sudden cardiac arrest.
So pacemakers are like steady drummers keeping the heart beating at a regular pace. And ICDs are like the emergency responders, ready to jump in when things go really wrong.
Exactly. These devices have revolutionized how we treat rhythm disorders, and they've helped millions of people live longer, healthier lives.
Wow, that's amazing. It's incredible how technology can support and even save lives. But how do you know if these devices are working properly? Do they need regular maintenance?
Oh, yeah, they do. We have to monitor them regularly to make sure they're functioning correctly. It's called device interrogation.
Device interrogation, that sounds intense. Is it like an interrogation room for the heart?
Not at all. It's totally painless and non-invasive. We use a special programmer. It communicates wirelessly with the implanted device. We can check the battery life, the pacing thresholds, and any data it's stored about the heart's activity.
So it's like a remote control for the heart. You can check the settings and make adjustments.
Exactly. It's super important for making sure these devices are doing their job and keeping the heart beating in a healthy rhythm.
That's incredible. It's amazing how we can manage and treat heart conditions in such sophisticated ways. Now, sometimes the heart needs a little help, like to regain strength after a big event, like a heart attack or surgery. What can be done in those cases?
That's where cardiac rehab comes in. It's designed to help people recover after a heart event and improve their long-term heart health.
So it's like physical therapy for the heart.
Kind of, yeah. It's a combo of exercise training, education, and counseling, all aimed at getting the heart strong and functioning well again.
What kind of exercises are involved?
It depends on the person and what they need, but it usually involves supervised aerobic exercise, like walking, cycling, or swimming, and strength training to build muscle. The goal is to gradually increase the heart's workload and improve its efficiency.
So it's a gradual process to build up stamina. What about the education and counseling parts? What are those like?
The education part is all about teaching people how to live heart-healthy lives. So we talk about diet, exercise, stress management, and how to stick to taking their medications. We also teach them how to recognize the signs and symptoms of heart problems.
So it's about giving them the knowledge to take care of their own hearts.
Exactly. And counseling gives them emotional support and helps them adjust to life after a heart event. They can learn to cope with anxiety, depression, or fear that might come up.
It sounds like a very holistic approach, addressing both the physical and mental aspects of heart health.
Exactly. Cardiac rehab plays a huge role in improving outcomes for people with heart disease. It can reduce their risk of future heart attacks and hospitalizations, improve their quality of life, and even help them live longer.
That's encouraging to hear. Now, I'm curious about a test I've heard of, the tilt table test. What's that all about?
That's a specialized test. We use it to figure out what causes fainting spells. We call those syncope. It's really helpful for diagnosing vasovagal syncope, which is when the body kind of overreacts to triggers, like seeing blood or standing for a long time. And that causes a sudden drop in blood pressure and heart rate.
So you're basically trying to trigger a fainting spell in a controlled environment so you can figure out what's causing it.
Pretty much. The patient lies on a table that tilts up, from horizontal to upright, and we monitor their blood pressure, heart rate, and EKG the whole time. If they faint, we can look at what changed in their vital signs and figure out why.
It's like detective work for fainting spells. Now let's talk about cardiac angiography. Is that similar to cardiac catheterization?
They both use catheters, but angiography is a specific X-ray procedure. We use it to see the coronary arteries, which are the blood vessels that feed the heart muscle.
So you're basically getting a roadmap of the heart's fuel lines.
Exactly. We inject a special dye into the coronary arteries. That makes them show up on X-ray, so we can see if there are any blockages or narrowing.
And why is it so important to see those clearly? Like, what kind of problems can you find?
Well, blockages or narrowing in the coronary arteries can reduce blood flow to the heart muscle, and that can lead to coronary artery disease, or CAD. CAD is one of the leading causes of heart attacks, so finding and treating it early is crucial.
So angiography plays a big role in diagnosing and managing CAD. What happens if they find a blockage? Can they treat it during the same procedure?
Often, yes. We can do a percutaneous coronary intervention, or PCI, to open up the blocked artery.
TCI? What's that?
It's a minimally invasive procedure. We use a catheter to get to the blocked artery. And there are different techniques we can use, like angioplasty and stenting, to open up the blockage and restore blood flow to the heart muscle.
Angioplasty and stenting. Can you explain those a little more?
Sure. Angioplasty uses a tiny balloon. We inflate it inside the blocked artery, and that compresses the plaque against the vessel walls. So the passage for blood flow is wider.
So it's like using a balloon to push the blockage out of the way?
That's a good way to think about it. But sometimes the artery might collapse again. After angioplasty, that's when we use stenting.
Ah, so the stent acts like a scaffold to hold the artery open.
Exactly. It's a small, expandable metal mesh tube, and we implant it permanently in the artery during the PCI, and that helps to keep it open, so there's good blood flow to the heart muscle.
It's like a long-term solution to keep the arteries clear. That's good to know. Now, I understand there's another procedure called coronary atherectomy. How is that different from angioplasty and stenting?
So atherectomy is also minimally invasive, but instead of pushing the plaque aside, it actually removes it from the artery.
Oh, wow. It's like a roto-rooter for the heart's arteries.
That's a good one. There are different types of atherectomy devices. Some use tiny blades to shave off the plaque. Others have rotating burrs that grind it away. And then the removed plaque is captured in a chamber and suctioned out of the artery.
Okay, so it's a more aggressive way to clear those blockages. When would a doctor choose atherectomy over angioplasty or stenting?
We often use it when the plaque is really hard or calcified,
Wow.
which makes it hard to compress with a balloon. It's also helpful for blockages that are long or in tricky locations.
It sounds like a valuable tool. Now let's talk about heart rhythm disorders. We've talked about pacemakers and ICDs, but what are some of the other treatments?
Well, besides those implantable devices, there are medications that can help regulate the heart rhythm. And there's the procedure called cardiac ablation that can be used to treat some types of arrhythmias.
We've talked about ablation before, with electrophysiology studies or EPS. Can you remind us how that works?
Sure, cardiac ablation uses energy, either heat or cold, to create tiny scars in the heart tissue that's causing the problem.
Yeah.
So by disrupting those pathways, we can often restore a normal heart rhythm.
So you're basically zapping the source of the problem. What kind of arrhythmias can you treat with ablation?
It's good for a variety of them, actually, including atrial fibrillation, supraventricular tachycardia, and ventricular tachycardia. Whether we use it depends on the specific type of arrhythmia, how severe it is, and other factors specific to the patient.
It sounds like a powerful way to restore a healthy rhythm. Now, I'm curious about another diagnostic tool, cardiac MRI. What's its role in evaluating heart health?
So cardiac MRI uses a strong magnetic field and radio waves to create detailed images of the heart. It's non-invasive and super safe. Gives us really good information about the structure and function of the heart.
So it's another way to look inside without surgery. How is it different from echo?
It provides a different type of image. It shows great detail of the heart muscle, so we can see things like scarring, damage, inflammation, and even tumors. It's also great for visualizing the valves and blood vessels.
So it's like having a high-resolution camera for the heart. What kind of conditions is it helpful for diagnosing?
Oh, a wide range. Congenital heart defects, valve disorders, cardiomyopathies, which are diseases of the heart muscle, and even coronary artery disease.
Wow, that's impressive. It seems like all these different techniques have their own, like, strengths and weaknesses. How do doctors decide which one to use?
It really depends on what we think the problem might be, the patient's individual situation, and what information we're trying to get. Sometimes we need multiple tests to get the full picture.
It's like putting together a puzzle, using different pieces of information to get a complete understanding of what's going on. Now, we talked about how echo can be used for stress tests. Are there other kinds of stress tests?
Yeah, there are. Besides stress echo, there's also the exercise stress test, which is probably the most common one.
Right, where you walk on a treadmill with an EKG.
Exactly. We monitor their heart rate, blood pressure, and EKG while they exercise. It helps us see how well their heart responds to the exertion, and we can detect signs of CAD or other heart problems.
What if someone can't exercise? Are there alternatives?
Yeah, if they can't exercise, we can give them medication that mimics the effects of exercise on the heart. We call it a pharmacological stress test.
So it's like a simulated workout. What kind of medications do you use?
Things like dobutamine or adenosine, they increase the heart rate and blood flow, so it's like they're exercising.
Okay, so it stresses the heart without physically stressing the patient. Are there any other types of stress tests?
Yeah, there's one that provides more detailed images of the heart muscle and blood flow. It's called the nuclear stress test.
Nuclear stress test. That sounds kind of intense. What makes it different?
So we inject a small amount of a radioactive tracer into the bloodstream. And that tracer is taken up by the heart muscle. And we can image it with a special camera.
So you can actually see how well the heart muscle is getting blood.
Exactly. And by comparing images at rest and during stress, we can find areas that aren't getting enough blood, which could mean there are blockages.
It sounds like a really powerful way to find CAD. Now, what about the tilt table test? Can you tell me more about that one?
Sure. It's non-invasive. We use it to figure out why people faint. We strap them to a table they can tilt up, from lying down to standing.
So you're basically recreating the experience of standing up too quickly.
Yeah, pretty much. And we monitor their blood pressure, heart rate, and EKG. If they faint, we can figure out why by looking at how those things changed.
What kind of information can you get from that?
We can find out if it's a problem with the autonomic nervous system, which controls things like heart rate and blood pressure, the involuntary stuff, or if it's a cardiac cause, like an arrhythmia or a structural problem with the heart.
So it helps you narrow down the possibilities. Now, we've talked about a lot of diagnostic tools and procedures. Let's switch gears and talk about cardiac rehabilitation. We touched on it briefly before, but can you tell me more about it, like how it helps people recover and improve their heart health?
Sure. Cardiac rehab is a medically supervised program for people recovering from things like heart attacks, heart surgery, and other cardiac events. It's a really comprehensive approach. It involves exercise, education, counseling, and lifestyle changes.
So it's like boot camp for the heart.
That's a good way to put it. Exercise is a big part of it. It helps improve cardiovascular fitness, strengthens the heart muscle, and makes people more tolerant to exercise.
What kind of exercises do they do?
It varies depending on the person and their abilities, but often it's a mix of aerobic exercise, like walking, cycling, or swimming, and some strength training. We start slowly and gradually increase how much they do as they get stronger.
Okay, so you're building up the heart stamina over time. What about the education and counseling parts?
Education is about giving people the knowledge to make healthy choices for their heart. So we talk about diet, exercise, stress management, and quitting smoking. We also talk about managing their medications and how to recognize the signs and symptoms of heart problems.
So it's about empowering them to take care of their own health.
Exactly. And counseling is about supporting them emotionally, helping them adjust to life after a cardiac event. Some people have anxiety, depression, or fear after these things, and we help them cope with those feelings.
So you're addressing both the physical and emotional aspects of heart health.
Absolutely. Cardiac rehab is really important for people with heart disease. It can lower their risk of having another heart attack, reduce the need for them to be hospitalized, improve their quality of life, and even help them live longer.
Those are really great benefits. Now, we've covered a ton of different diagnostic tools and treatments. It seems like technology plays a huge role in how we understand and manage heart disease. But what about the role of the doctors and nurses? How important are they in all of this?
The human element is absolutely essential. Technology is great. It gives us all these amazing tools, but it's the healthcare professionals who interpret the data, make diagnoses, create treatment plans, and provide compassionate care.
So it's really a partnership between technology and human expertise.
Absolutely. Cardiologists, cardiac surgeons, nurses, technicians, therapists, everyone plays a vital role
Mm.
in providing comprehensive cardiac care.
This has been a fascinating.
Deep dive into the world of cardiac diagnostics.
It really has been. It's amazing how far we've come in understanding how to diagnose and treat these conditions. Like we've gone from just listening with a stethoscope to having this whole toolbox for like looking inside, measuring things, even fixing things in this incredibly complex organ. Speaking of fixing things, I'm curious about PCI, percutaneous coronary intervention. We talked about it a little earlier. Could you remind us what it is and why it's so important?
Sure. So PCI is a minimally invasive procedure. We use it to treat coronary artery disease, specifically those blockages in the arteries that supply blood to the heart muscle.
So it's a way to clear out those clogged arteries without having to do open heart surgery.
Exactly. It's become the go-to treatment for a lot of CAD cases. We insert a catheter into a blood vessel, usually in the groin or arm,
Mm-hmm.
and guide it to the blockage.
And then what? How do you actually open it up?
Well, there are a few different techniques, but angioplasty and stenting are the most common.
Right. We talked about those briefly before. Can you remind us how they work?
Sure. So angioplasty involves inflating a tiny balloon at the tip of the catheter, right inside the blocked artery. That pushes the plaque against the walls and widens the space for blood to flow.
So it's like using a balloon to push the blockage out of the way.
Yeah, that's a good analogy. But sometimes the artery can collapse again after angioplasty. That's where stenting comes in.
Ah, right. The stent is like a scaffold. It holds the artery open.
Precisely. It's a small, expandable tube made of metal mesh. And we put it in the artery permanently during the PCI, and that helps keep it open, so blood can flow properly to the heart muscle.
It's like a permanent solution to keep the arteries clear.
Yeah, you could see that.
Now, I know there's another procedure called coronary atherectomy. How is that different from angioplasty and stenting?
So coronary atherectomy is also minimally invasive, but instead of just pushing the plaque aside, like with angioplasty, it actually removes the plaque from the artery.
It's like a roto-rooter for your arteries?
Uh-huh. Yeah, that's a good one. There are a few different types of atherectomy devices. Some have tiny blades that shave off the plaque. Others have these rotating burrs that grind it away. And then the plaque is captured in a chamber and sucked out of the artery.
Okay, so it's a more aggressive approach. When would you choose atherectomy over angioplasty or stenting?
Usually when the plaque is very hard or calcified. It's tough to compress that kind of plaque with a balloon. Atherectomy can also be helpful when the blockage is long or in a tricky spot.
It sounds like it's a good option to have. Now let's talk about heart rhythm disorders for a minute. We talked about pacemakers and ICDs, but what are some of the other ways to treat them?
Besides those implantable devices, there are medications. They can help regulate the heart rhythm. And then there's cardiac ablation, which can be used for certain types of arrhythmias.
Right, ablation. We talked about it in the context of EPS, electrophysiology studies. Can you remind us what that involves?
Sure. So in cardiac ablation, we use energy, either heat or cold, to create tiny scars in the heart tissue. That's causing the abnormal rhythm. By messing up those faulty electrical pathways, we can often get the heart back to a normal rhythm.
It's like you're zapping the source of the problem. What kind of arrhythmias can you treat with ablation?
It's effective for a lot of them. Atrial fibrillation, supraventricular tachycardia, ventricular tachycardia. We decide whether to use it based on the specific type of arrhythmia, how severe it is, and other factors specific to the patient.
It sounds like a really effective treatment. Now, I'm curious about cardiac MRI. What role does that play in evaluating heart health?
Cardiac MRI uses a strong magnetic field and radio waves to make detailed images of the heart. It's non-invasive and very safe, and it gives us great information about the heart's structure and function.
So it's another way to see inside without having to do surgery.
Yeah.
How's it different from echocardiography?
Well, it provides a different type of image. MRI is really good for looking at the heart muscle. We can see things like scarring, damage from a heart attack, inflammation, even tumors. It's also great for visualizing the heart valves and blood vessels.
So it's like having a high-resolution camera for the heart. What kind of conditions can you diagnose with cardiac MRI?
A lot of them, actually. Congenital heart defects, valve disorders, cardiomyopathies, which are diseases of the heart muscle, and even coronary artery disease.
That's amazing. It seems like all these different imaging techniques have their own strengths and weaknesses. How do doctors decide which one to use?
It depends on a few things. What we think the problem might be, the patient's specific situation, and what we're hoping to learn from the test. Sometimes we need to do a few different tests to get the full picture.
It's like putting together a puzzle. Each test gives you a different piece of information. Now, we talked about using echo for stress tests. Are there other kinds of stress tests?
Yeah, definitely. Besides stress echo, there's the regular exercise stress test. That's
Yeah.
probably the one people are most familiar with.
Right, where they walk on a treadmill with an EKG hooked up.
That's the one. We monitor their heart rate, blood pressure, and EKG while they exercise. It tells us how well their heart handles the extra work, and we can spot signs of CAD or other issues.
What if someone can't exercise? Is there another option?
Yeah, we can give them medication that mimics the effects of exercise on the heart. It's called a pharmacological stress test.
So it's basically a simulated workout. What kind of medication do you use?
We use medications like dobutamine or adenosine. They make the heart rate and blood flow go up, just like they would if the person was exercising.
So it stresses the heart without the patient having to physically exert themselves.
Exactly.
Are there any other types of stress tests?
There's the nuclear stress test. It gives us really detailed images of the heart muscle and the blood flow.
Nuclear stress test. That sounds a little intimidating. What makes it different from the others?
We inject a small amount of a radioactive tracer into the bloodstream, and the heart muscle absorbs it. Then we can see how it's distributed with a special camera.
So you can see how well the heart muscle is being supplied with blood.
Exactly. By comparing images taken while the person is at rest and during stress, we can identify any areas that aren't getting enough blood, which could mean there's a blockage.
It sounds like a really accurate way to find coronary artery disease. Now, what about the tilt table test? Can you tell me a little more about how that works?
Sure, it's a non-invasive test. We use it to try to figure out why someone is fainting. Basically, we strap them to a table that tilts, so they go from lying flat to standing up.
So you're mimicking what happens when someone stands up too quickly?
That's right. We monitor their blood pressure, heart rate, and EKG the whole time. And if they faint, we can look at those readings and get a better idea of what's causing it.
What kind of information can you get from that test?
It can help us determine if the problem is with the autonomic nervous system, that controls things like heart rate and blood pressure automatically, or if it's a problem with the heart itself, like an arrhythmia or a structural defect.
So it helps you rule things out. Now, we've talked about a ton of diagnostic tools and treatments. Let's talk about cardiac rehabilitation for a bit. We mentioned it earlier. Can you tell me more about what it is and how it helps people recover and improve their heart health?
Of course. Cardiac rehabilitation is a medically supervised program. It's designed for people who have had a heart attack, heart surgery, or some other heart event. It's a really comprehensive program. We combine exercise, education, counseling, and lifestyle changes.
So it's like boot camp for the heart to get it back in shape.
That's one way to think about it. Exercise is a big part of it. It helps improve their overall fitness, strengthens the heart muscle, and makes them better able to handle exercise.
What kind of exercises do they do?
It varies depending on the person and their physical abilities. But we often do a combination of aerobic exercise, like walking, cycling, or swimming, and strength training exercises. We start them off slowly and gradually increase the intensity and duration as they get stronger.
So you're building up their stamina over time. What about the education and counseling components? What do those involve?
We educate patients about making heart-healthy lifestyle changes, things like diet, exercise, stress management, and not smoking. We also teach them about their medications and how to recognize the warning signs of heart problems.
So it's about empowering them to take care of their own health.
Exactly, and the counseling component provides emotional support. Recovering from a heart event can be scary, and we help them adjust to life after the event and cope with things like anxiety, depression, or fear.
So you're really addressing both the physical and emotional aspects of heart health.
That's right. Cardiac rehab is so important for people with heart disease. It can lower their risk of having another heart attack, reduce their chances of needing to be hospitalized, improve their overall quality of life, and even help them live longer.
Those are some pretty amazing benefits. It sounds like cardiac rehab should be a standard part of recovery for anyone who's had a heart event.
It really should be.
I know we've talked about a lot of technology, all these diagnostic tools and treatments. It's clear that technology is playing a huge role in how we understand and manage heart disease these days. But what about the human side of things? How important are the doctors and nurses in all of this?
The human element is absolutely crucial. Technology gives us incredible tools. But it's the healthcare professionals who interpret the data, make the diagnoses, develop the treatment plans, and provide compassionate care.
So it's really a partnership between technology and human expertise.
Exactly. Cardiologists, surgeons, nurses, technicians, therapists, they all play a vital role in providing comprehensive cardiac care.
This deep dive has been really eye-opening. It's amazing to think about all the different ways we can diagnose and treat heart conditions now. We've covered so much in this deep dive. EKGs, echocardiograms, catheterization, ablation. I gotta admit, it's a lot to take in, even for me, and I'm fascinated by this stuff.
It is a lot, especially if you're not dealing with it every day. That's why these deep dives are so helpful. We break it down into smaller pieces and highlight the most important things everyone should know.
That's true. So as we wrap up this deep dive on cardiac diagnostics, what are some of the key takeaways? Like, what's the most important stuff you want our listeners to remember?
Well, the biggest thing is that heart disease is preventable, in most cases anyway. Making healthy choices like eating right, exercising, staying at a healthy weight, and not smoking. Those things can really reduce your risk.
We hear that all the time, but it's easy to forget how much those choices actually matter.
It's like small changes over time add up to big results. And if you're worried about your heart, don't wait. Talk to your doctor. Catching and treating things early is so important.
Absolutely. We've talked about a bunch of different tests and procedures, but what's coming next? What are you most excited about in the future of cardiac diagnostics?
Oh, there's a lot to be excited about. AI is really taking off. They're developing algorithms that can analyze images, like echocardiograms and MRIs, with incredible accuracy. So they can help doctors find things that might be really subtle, things we might miss with the naked eye.
So it's like having superhuman vision.
You could say that.
What else is there?
Liquid biopsies are showing a lot of promise. That's where we analyze a blood sample to look for biomarkers that could tell us if someone has heart disease, even before they have any symptoms.
Wow. So like a crystal ball for heart health.
It's still early days, but it could change everything about how we screen for and diagnose heart disease.
That's incredible. It feels like we're on the verge of a whole new era in cardiac care, with technology playing a bigger and bigger role.
I agree. But it's not just about the technology. The human element will always be essential. Doctors, nurses, all the healthcare professionals, they're the ones who provide the care and compassion.
Right, it's a team effort. This has been such an informative deep dive. I have a much better understanding now of how complex the heart is and all the amazing ways we can diagnose and treat problems.
I'm glad to hear that. I hope everyone listening feels empowered to take charge of their heart health, make healthy choices, talk to their doctor if they have concerns, and stay curious about the latest advancements.
Absolutely. Knowledge is power, especially when it comes to our health. And the heart is such an important organ. We need to take good care of it.
Well said. Remember, a healthy heart means a healthy life.
That's a great reminder. Thank you so much for joining us on this journey. It's been a pleasure talking with you.
The pleasure was all mine. And thank you to everyone listening. We hope you learned a lot. Until next time, take care of your hearts.